Now let's talk about second generation atypical antipsychotics. We're going to use Risperidone or Risperidone as the prototype. Other medications in this drug category include aripiprazole or Abilify, clozapine, also known as Clozaril, lorazepam, which is Latuda, olanzapine, which is Zyprexa, paliperidone, also known as Invega, quetiapine or Seroquel, and ziprasidone, which is also Geodon. Sapphirus and Fanapt we don't use as much in practice. The purpose of these medications is to mainly block serotonin and to a lesser degree dopamine receptors. They also block receptors for norepinephrine, histamine, and acetylcholine. The therapeutic use of this medication class is negative and positive symptoms of schizophrenia spectrum disorders, psychosis induced by levodopa-therapy, relief of psychotic manifestations and other disorders such as bipolar disorder. So complications or adverse effects of second generation atypical antipsychotics, and remember our prototype here is Risperidone, include a new onset of diabetes mellitus. These individuals can have glucose control problems if they already had diabetes. So we want to obtain the baseline fasting blood glucose and monitor this during treatment. I would also encourage you to get an A1C test. Instruct the client to report indications like thirst, urination, or appetite of issues with blood glucose. We want to look out for weight gain. Advise the client to follow a healthy, low-calorie diet and engage in regular exercise. So we're going to monitor the weight gain. These individuals can have an increased risk for hypertension and other cardiovascular disease because of cholesterol issues. So we need to watch their cholesterol, triglycerides, and blood glucose, and we want to try to keep the weight gain under 30 pounds. So here's some more complications of second generation atypical antipsychotics, prototype Risperidone. Anticholinergic effects. So can't see, can't pee, can't poop, dry mouth. That's how I remember anticholinergic effects. So urinary hesitancy or retention, constipation. So again, we're going to encourage these individuals to increase their water, increase their fiber intake, sugar-free gum. Some individuals may experience agitation, dizziness, sedation, or sleep disruption. So they're going to notify their provider if that happens. That's what we'd like to educate them to do. They may need an alternative medication. Orthostatic hypotension may occur. So we want to monitor the pulse and blood pressure if patient has complaints of this. And of course, educate them that it could happen. And with these medications, they may experience mild EPS, like a tremor. So we want to teach the clients to recognize EPS symptoms and monitor for these. And remember, we can use the AIMS screening tool for EPS symptoms. Risperidone or Risperidone should be given with precaution or is contraindicated in the following categories. And remember, this applies to most second generation atypical antipsychotics. So it is a pregnancy risk category C medication. It should not be used for clients who have dementia or who drink alcohol. So you should not drink alcohol with this medication. Use of this medication or these class can cause death related to cerebrovascular accident or infection. So you have to use it cautiously if the patient has cardiovascular or cerebrovascular disease, seizures, or diabetes mellitus. Remember, if they have diabetes mellitus, they need a baseline fasting blood sugar, and I would argue A1C, and their blood glucose should be monitored carefully. Let's talk about nursing administration with Risperidone. So Risperidone is also available as an IM, so you can give that every 2 weeks. and it's a good option for people who struggle with medication adherence. The therapeutic effect occurs 4 to 6 weeks after the first depot injection. Let the clients know, hey, we're going to give you a low dose of the medication initially, but then it may gradually need increased. Some clients are cheeky. That means that they attempt to cheek or pocket their tablets into the side of their mouth, and they don't swallow them. So for those clients, Risperidone has a disintegrating tablet. For Latuda, we need to take that with food. And for Acenapine, we avoid food for 10 minutes after each dose. The cost of antipsychotic medications can be a factor for some patients, so assess the need for case management intervention. When evaluating medication efficacy in atypical antipsychotics or second-generation antipsychotics, we want to know if there's been an improvement or prevention of psychotic manifestations, an absence of hallucinations, delusions, anxiety, or hostility. We are also looking for an improvement in ADLs, the ability to interact socially with peers, and an improvement in sleeping and eating habits.